Well, a new study finds diabetics are making dangerous decisions to save money during record high inflation. A study published in the Annals of Internal Medicine shows over the last year, more than 1 million diabetic Americans ration their insulin, either by skipping doses, taking less, or delaying buying it. Duke University School of Medicine endocrinologist and assistant professor Dr. Afreen Shariff is joining us live from North Carolina. Thank you for being here this morning. We'll dive right in. These new numbers show around 3 in 10 uninsured Americans and around 2 out of 10 people with insurance had to ration their insulin in the past year. So are those numbers alarming to you?
Well, it's not surprising to see these numbers because we do see this in practice as well. And it's a sad reality and a reflection of our current economy and the result of our healthcare policies. Life in general in the post-COVID era has become more expensive, and job instability, in addition, plays a huge role since people lose their jobs, they lose their insurance. And due to these situations, we're starting to see more and more Americans are having to make difficult choices between paying for essentials like rent, food, and important medications like insulin. And to add to this, the cost of insulin has irresponsibly been increased over the last 15 years by about 350%. And that is surprising. So it's about time that policies change, especially for the nearly 38 million diabetes patients here in America. So these numbers are not surprising. They're not astonishing.
All right, so that's really interesting, and we do want to dive into that in this interview as well. But I think the million-dollar question is it safe to ration insulin or any medicine that you've been prescribed?
Absolutely not. And especially when it comes to insulin and patients who are insulin dependent with type 1 diabetes, their life depends on the availability of insulin. And if they don't have insulin, for a day or a few hours, they can end up in a hospital. And that is why rationing a life-sustaining medication like insulin and capping the cost is essential for our healthcare system.
So I think you hinted at it a little bit, but does this study prove universal access to insulin without cost barriers is urgently needed?
Well, it is a need of the hour. I think this is a long time waiting. Now, interestingly, we just celebrated 100 years of insulin being discovered, and insulin has been around since 1921. So the 2 Canadian scientists, Banting and Bess, who discovered it, sold the patent for a whopping $1. And Banting very famously said, insulin does not belong to me, it belongs to the world. And here we are, 100 years later, still discussing the cost and the rising cost of insulin and why Americans are having to pay so much more for a life-sustaining medication. So it is absolutely needed. It is the time of the hour, and I'd say it's too little too late right now.
So do patients have any options to access more affordable insulin?
Absolutely. There are some options. There are difficult options. So these are just, I would say, band-aids to the bigger problem where access of insulin based on the cost has been a big issue for the last few decades now. So I don't think waiting for policies is going to change anything for our patients right now. For the current situation, patients need insulin now, and there are a few ways in which patients can access low-cost insulin. One of the ways is patient assistance programs that patients can discuss with their prescribing doctors. They can also look into using savings cards, which are typically available to the insulin manufacturing companies. And they can go to the website and look for these savings and discount cards, and also discussing with the pharmacist and how to access this information and get discounts is another way to get help. But most importantly, speak up. If you're not able to afford your insulin, talk to someone about it. We have better and cheaper options. There are older insulins, which are regular and NPH, that work just as effectively and cost a lot cheaper. They're about $25 for 100 units of insulin. But these are conversations you need to initiate with your healthcare provider and inform them that it is a pinch for you to pay for your insulin, and you might end up rationing it. So this is relevant and important information. So yes, there is some options that are available, but they're not perfect.
Dr. Afreen Shariff, thank you for joining us this morning.
Well, thank you for discussing such an important topic.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.